Assalamu alaikum. We are starting this session with a female patient named Miss Julia. She's 30 years with complaint of finger pain. Let's start timer, then we'll start the practice. You ready?
I am ready.
Okay, let's start.
Hello. Hello.
Hi, doctor.
I am
Hello,
Dr.
doctor.
Abdul Karim. I'm Dr. Cover Clinic today. Nice to meet you. I am talking to Mr. Julia, 30 years old.
Yes, I am doctor.
I am talking to Mr. Julia, 30 years old.
Yes, I am doctor.
Yeah. Miss Julia, we are here today to discuss some issue related to your health condition. That is okay with you?
Yes, okay, doctor.
Yeah. Miss Julia, come to my knowledge, you have been troubled with some pain in your hand, in your fingers. Can you tell me more about that?
Yes, doctor. Actually, I have this pain in all my fingers, doctor.
Yeah. When this started?
This started since like 1 month. I noticed it from time to time.
From the start, it started gradually or sudden onset?
It was gradual.
Gradual. Is the first time to experience this pain?
Yes.
Yes, it's the first time. From the start point up to now, it is increasing, decreasing, or static.
It is same. Yes.
Do you notice anything that bring to you the pain or increasing for you the pain?
No.
Do you notice anything make you better and relieving this pain?
No.
You notice anything that
No voice.
this
Hello.
Yeah, please check your connection, doctor.
No,
No,
doctor. No.
no, no, Dr.
Yes.
Nusayba.
in your
Dr.
finger
Nusayba.
related to your today time.
Dr. Nusayba, I
Yes, my
stopped the
connection is
time.
good. I hear all.
Okay,
Dr. Basim,
resume
I
now.
hear the all. My connection is
Okay,
very good. I hear
resume.
all.
Okay.
Do you notice this pain related to specific time of the day?
No, doctor. No.
No. Miss Julia, this you have experienced this pain in your hand. This pain is relieving by shaking hands.
No, doctor. I didn't notice this.
Yeah. When this pain started, it start at the wrist or the fingers?
It's in my fingers, doctor.
Only in my fingers is not involved the wrist or the palms.
Yes, sometimes in palms also, but
In
nothing
the
in the
palm,
wrist.
nothing in the wrist. Miss Julia, before go further in our discussion, there is any past medical history of nose should be aware of?
No, no, doctor. Actually, I had surgery, doctor, in the past.
Yeah. When this surgery?
This was since 1 month.
1 month. Surgery. The site. What is the site of the surgery, Miss Julia? I can see. I can see.
Yes, doctor. They took from the surgery was to remove my thyroid gland.
Yeah. Really sorry for that, Miss Julia. Miss Julia, with this pain, do you have this? There is abnormal tingling sensation over your hands, over your fingers.
Sorry, tingling sensation. Yes,
Miss
I have.
Julia?
Yes, doctor, I have tingling sensation.
Tingling sensation. There is any change of the color with this pen? Change of the color of tip of your finger with this pen?
No, doctor, at all.
No. There is any neck pain or neck trauma, history of neck trauma?
No,
No. You tell Miss Julia, you have this surgery about 1 month ago. For what this surgery?
I had increased the activity of the gland in the front of my neck, doctor. That's why they removed it, and also it was enlarged.
Really sorry for that.
Mhm.
Yeah, really sorry for that, Miss Julia. Miss Julia, you have abnormal sensation around your mouth.
Yes,
Yeah. You have any raising of the heart or awareness of heartbeat?
no, doctor,
You have any shaking or abnormal movement over any part of your bodies?
no,
No. Miss Julia, apart from this surgery, you have any past medical history of note should be aware of?
no, doctor,
No. Miss Julia, you can ask you some questions, if not mind. There is any headache,
no,
any blurring of visions?
no.
You can see the side of the road clear?
Yes, doctor,
Yeah, you have any mouse deviated to one side of your face?
no,
Any weakness, any part in your body?
no,
Yeah. Any abnormal sensations in others than your hands, in your on your legs or other part of your body, and your apart from this tingling sensation and around the mouth sensation, any other part will be abnormal sensation?
no.
No. Miss Julia, you have any history of chest pain,
No, doctor,
any history of cough or cough up blood,
no,
any history of raising heartbeat
no,
or lower limb swelling?
no,
No. You have any tummy pain or tummy distension?
no, doctor,
You have any change of your bowel habits?
no,
You have you have any change of your water work
no, doctor,
in color, amount, frequency?
no,
Any puffiness of your eyes?
no,
Any joint pain, skin rashes,
no,
joint stiffness?
no.
You have any muscular pain?
No, doctor, I haven't.
Any bony pain?
No,
Any difficult to raise up from the chair, to stand up from sitting position?
no,
Any back pain?
no.
Yeah. Can you show me your medication list, Miss Julia?
Um, I'm not taking any medication except that medication that given for me after surgery, which is thyroxine.
Thyroxine only.
Mm-hmm.
You have any complication in this surgery?
No, doctor, it was okay.
No. Okay. Other than thyroxine, there is nothing to be taken.
No, doctor, at all.
Yeah. Any family history of similar condition?
No,
Any his family history of significant cancers or illness should be aware of?
no.
No. Miss Julia, can I ask you some private questions?
Yes, doctor.
Yeah. What about your period?
Uh, Nothing, doctor.
Is it regular?
Yes, regular.
Any change of your period?
No,
No. You have any problems with intimate relationship?
no at all.
Yeah. What you are doing for living, Miss Julia?
Yes, doctor. I am teacher.
How these symptoms affect your job and daily life
It
activity?
affects. I can do my job, but a little bit. I feel that I am uncomfortable with this sensation in my hand.
Yeah, I really sorry, Miss Julia. If not mine, I will can give you illness note, so can give you sick leave and can refer you to health occupational doctor to see how can help us regarding this issue.
Okay, doctor. Thank you.
Yeah, you have smoking before
Um, no, doctor.
alcohol. You are taking alcohol.
No, doctor.
Miss Julia, what your concern, Miss Julia? I can summarize you to Miss Julia. Our talk, you have been experiencing this pain over your fingers for last 1 month. This pain is, have past medical history of surgery in the anterior neck to remove one gland and only on thyroxine, and you have this pain in the tip of the finger and palms, and there is abnormal sensation around the mouth and have denied any history of shaking or raising heartbeats or change of the bowel habits or muscular pain or bony pain. If you want to add anything more, Miss Julia?
No, doctor. That's all. Yes.
Yeah, I want to examine the pulse.
Yes, the pulse is normal. All the vital normal.
Regular.
Yes,
I
regular.
want to sign arrhythmia for hypocalcemia.
Negative.
Blood pressure.
Normal.
I want to see Jofrinski signs. I will excuse the patient to tap over the jaw to see it's positive.
It's positive. Yes.
Yeah. When measuring blood pressure, I will excuse those signs.
Yes, the scales are fine. Doctor.
Yeah. I want to see the thyroid status of the patient. I want to see the hand shaking, hand tremors, see the pulse volumes and
Negative.
الstatus الثيرويد of the patient by the pulse والهاند shake والهاند sweating
Yeah, all negative.
all negative. Miss Julia, can I know what is your concern?
Yes, doctor. What is my problem, doctor?
Yeah,
Please, if you have any treatment for me, please.
yeah, Miss Julia. Really sorry, Miss Julia. I appreciate your concern. From our talk and after examining you, seem to be have what is called hypocalcemia. This not this def, this is there is deficiency of one of important salt in your body. Is called calcium. Because of this decrease in the calcium, you experience this pain over hands and numbness sensation over your mouth, and this related to that surgery done in the 1 month ago for thyroids. Actually, what now not need to do now? We need to send labs for and to do imaging for your anterior neck and want to be admitted, okay, and do some cardiac tracings,
2 minutes
what's
remaining.
called ECG, cardiac tracing called ECG. If this salt is the low, we'll give calcium through the needles into your blood channels. That's okay, Ms. Julia?
It's okay, doctor.
I will need to do both in this replacement for this calcium to not be have experienced this hypocalcemia again, and want to refer you treat you as multidisciplinary teams in the form of gland doctors and social workers, occupational health doctor, and specialized staff nurse. That is okay, Miss Julia.
Yes, okay.
Any more concern, Miss Julia?
Not sure.
Okay.
But if there's any treatment, so there is a treatment. My condition, it will be treated.
What?
So there is a treatment for my condition. This
Yeah,
good.
there is treatment for your condition. Will be treated by give this replacement for this salt. We'll give. Will now. We'll see if there is low level. We'll give as through the blood channels. After that, can put in the tablet replacement.
Okay, doctor. Thank you.
Okay, if you're done, let's go to the examiner time.
Yes, okay. Yes. What is your finding for this patient?
This patient, Miss Julia, 30 years old, have been tendering sensation in the fingers with the numbness around the mouth with the history of thyroidectomy about 1 month ago and only on thyroxine tablets replacement. This sign suggested hypocalcemia, most likely related to thyroidectomy surgery or parathyroid glands, parathyroid hormone deficiency due to surgery.
Okay. And also on examination.
Examination, there is positive Jablinski signs.
Yes.
There is positive Jablinski sign, and but there is negative for cardiac arrhythmias and patient in thyroid status.
Yes. What is your definition for the finger pain in this patient?
What?
What is the differential of finger pain in this patient?
Finger pain in this patient may be related to hypocalcemia, that my first differential. After that, carpal tunnel syndrome, renal phenomena, reticulopathy, cervical reticulopathy.
Yes. Any other differential? Okay. How you will
Okay.
investigate this patient?
I will investigate this patient. I will send CBC and liver, renal function test, blood electrolytes, calcium, phosphorus, potassium, parathyroid hormones, and LFT, and C-reactive protein, and ESR. I will do ECG, heart ECG to regarding arrhythmia. I will do neck ultrasound. Neck ultrasound.
Okay. Okay. How you treat the patient?
What?
How will you treat the patient?
How will admit?
I'll treat the patient. Treatment.
I will treat the patient admission for the patient. If the calcium is low, we'll give IV calcium and we'll give calcium tablets in the form of the multidisciplinary teams, as a patient can need emergency low calcium level, may need IV calcium with ECG monitoring. After that, I will refer patient to gland doctors to give replacement therapy and calcium therapy.
Okay, thank you.
That's it. Okay. Any other question, Dr. Wati?
No, that's all my question.
Okay. Let's talk about the team here, multidisciplinary. She mentioned.
He didn't talk in details on the treatment. صح دكتورة نسيبه
Yeah.
or what Dr. to comment or Dr. Basim or what?
No. Let's start the comment from you, then I will comment.
Yes, okay. Yes, previously when I talked to you about the pain, you need to ask me about the nature. This will be more easily. If you ask me about the nature, then I can ممكن to say to you that this tingling pain. You screened about the cause of hypocalcemia. Good, but you forget to ask about familiar causes. Because it can be hypercalciuric hypocalcemia also. Um, so by family, any family illness of similar condition, and also if there is any history of renal stone. Um, uh, this is about the symptoms, very good. Even the osteoporosis of the hypocalcemia can you need to ask about bowel habit change, diarrhea. Um, yes, in the before examination. Yes, in the examination. In the examination, you have to take time to tap on the feet, not the jaw. And also, during the Dr. Nusaiba, because I didn't notice that you asked about cervical myelopathy. You can ask, I think, if there is any trauma history. Yes. And in the examination also, you said that you screened for the uh, thyroid status. This is good, but you didn't see the scar because there was
Dr.
case
Awatif,
came
your
and
connection
the scar
is
was not
little.
in the neck, was in the axilla.
Dr. Awatif,
My
your
connection?
connection. Yeah, some
Yes.
interruption, please. Yeah.
Now it is good.
Yeah, okay.
Yes, in the examination regarding the thyroid, you need to see the size of the scar also, because sometimes it can be in other area like axilla. And in the workup, you didn't screen for thyroid function test. You need to check for thyroid function test also. For the hypothyroid, yes, as you said exactly, but to be more professional, you can say parathyroid hormone, skin parathyroid hormone, and bone profile, which is include phosphorus and calcium and parathyroid and like this. And also liver function test plus albumin, renal function test. All this will be under the uh, basic investigation. Uh, yes, regarding the treatment, um, I think you did not say multidisciplinary team. Yes. About the other treatment is good, and also the way that you talked about the treatment is good. This is my opinion.
Yeah, thank you, Dr. Awatif. Thank you for a nice case. Thanks, Dr. Nusaiba. Good performance. Dr. Awatif, please check your headphones before starting your case because there is some unclear
Okay.
sound. I don't know. Yeah, please check it. Okay, until that time, I will comment on Dr. Nusaiba. So starting from the complaint, the analysis of complaint, onset, course, duration, she did it well. 1 month gradually increasing in the previous its first time. You ask all this and increasing what improve it, what's worth it, but you didn't ask about the nature, as Dr. Awatif said, the nature of the pain. Is it electric like shock? Is it like burning? Is it benzoline? But later on, you mentioned the tingling, but better to ask from the start, just to have a clue from the pain. The pain scale, as this pain, you should ask for the pain scale. From 0, no pain, and 10 is the maximum intensity, you should ask. Good question. Also, you ask the side, which hand, both hands, and the side you ask for the palm, the finger, the tip, and is it improving by shaking to rule out carpal tunnel syndrome? It was a great question. The color for the Raynaud's. Any trauma? She asked Dr. Awatif about trauma. But you should mention trauma to the hand or trauma to the back, to the neck. It's important. Then, when you catch the diagnosis, you ask about the sensation around the mouth, and it changes the sensation to confirm the diagnosis that it's hypocalcemia. From this point, you have the case. Then you will ask for the association of hyperthyroid and the related the endocrine disease, which was hyperthyroid. You ask for the medical history earlier, just to catch what behind these things, and you found that the patient is having surgery previously in the thyroid, and it was hyperactive thyroid. Then you ask about the medication, but you didn't ask more about thyroxine. Is she regular taking, compliant, and how she feel about her endocrine state after the surgery? You can ask her. Okay, and the follow-up, very important, the follow-up, because anyway you will send her for screening, and you will do the screening even by yourself. Then any other medication list you ask, any other medical condition. Then the way you talk, the system review, every step I'm writing, you are doing the same question. You are too much organized. Really, I like what the system review you did from up downward. The CNS, the headache, and the vision side vision to roll out pituitary for men. It was also a wise question. Then you ask for the cardiovascular, chest pain, awareness of heartbeat, which is important in this patient. The endocrine related to the condition, the thyroid state. I guess you didn't ask. You missed the endocrine state or the endocrine system about the weather preferences, because it might tell you if she's controlled or not. However, you can do in the examination. Then the chest, cough or cough up of blood, the GI, pain or distension or bowel habit change, the genitourinary water work, amount or color, skin rash, skin joint pain, muscle pain, but don't say muscular pain, muscle pain, okay? Because you said muscular pain. So any muscle pain, any bone pain, exactly what I'm writing, the system you are asking at the same time. So you are too much organized in the system review. The female history, you did it, the period, it was normal, and the intimacy. Then let's go to the constitutional. You miss all constitutional symptoms. All constitutional symptoms miss. The loss of weight, the appetite, lumps or bumps, fever or high temperature, and night sweats. Family history, ask for any cancer, but you miss gland. You can ask gland disease because you might diagnose the men, and you might have also the disease mentioned by Dr. Awatif, hypocalcemia, hypercalciuria. Familiar hypocalcemia, hypercalciuria. This is an inherited condition, and the patient will have hypocalcemia along with hypercalciuria, renal stone, and hypercalcium in the urine, high calcium in the urine. Travel history, they didn't ask. The HIV, all HIV, you didn't ask. Maybe it's not logic here to ask about HIV. And the job, the smoking, the alcohol. You can add driving if she is not feeling her hands. You feel this question will affect her driving, you can ask. Especially anything related to the activity or the vision. If not, you can ask her, did it affect your driving? I mean, if she's driving and you're not sure it will affect her driving or not, you can ask her, was that affected? Might she tell you, I had accident last week because of I didn't because of no sensation of the the control of the wheel or the wheel control. So it's logic to ask this question. However, it might be also not significant, but for me, any activity or any complaint might affect the driving. I will ask in this way: did you have or did you or your driving was affected by your job? Sorry, by your symptoms or no? If yes, I should advise her to stop, whatever the disease, hand, vision, any disease, especially the musculoskeletal one. Maybe ankylosing spondylitis also it affect, but indirect way through the back limited movement or the neck limited movement. And so our differential. Let's go to the examination. I don't know. You did the examination very quick. You have time. 2 minutes was there at the end. You can do examination, but you just ask for the vitals and the signs of Chivostek and Trousseau. Target examination, yes. The pulse you ask, blood pressure and vitals, as I said. The general look, important. Then the thyroid state and the scar. It's near since 1 month. You should ask about the scar, any complication, any bleeding, any even darkening of the scar, and some scars leaving fluid. Just show the examiner that you are aware about the thyroidectomy scar. Just you can cross your hand over the scar and show him that you discover it. You can ask also to drink sip of water to check the thyroid state, and the eye examination also is important here for any eye affection due to the previous thyroid state. You might have gaves and still the symptoms or the signs is there. However, it's supposed to be disappeared, but sometimes takes time. And the differential in this patient, lymph node, you did ask, yes, about lymph node. Differential. So I put differential for hand pain. I cannot tell about hypocalcemia differential because the complaint was hand pain. So what I wrote and mentioned by Dr. Nusayba as well, it was hypocalcemia and Raynaud and carpal tunnel syndrome and cervical myelopathy. But every differential you can mention that what against. But if you put differential for the hypocalcemia itself, it will be different. I'm not sure to put hypocalcemia as differential in this patient. It was the complaint was about hand or finger pain. Okay, the diet, Dr. Nusayba, you should ask about the diet to rule out any diet affection or malabsorption. As Dr. Nusayba said, Dr. Awatif said also about the diarrhea. It might be there, and it might be the reason of hypocalcemia, along with also some diuretics. So this is the case today. Any comment, any question? With low calcium? Yeah, there is question here. Why asking for men 1 with low calcium if no history of parathyroid surgery? Yeah, sorry. I didn't mean for the calcium. I meant for the thyroid. So it will be autoimmune polyglandular. Sorry. Yeah, mistakenly. Sorry, Dr. Nada. Yes, you're right. It's not for the calcium. I meant for the hyperthyroid state. So it's like autoimmune association. Yeah, you're
Yes,
right,
Dr.
Dr.
Basim, I
Nada.
have a
Yes.
question.
Uh-huh. Dr. Mahmoud. Yeah. Yes, Dr. Mahmoud. Hello. Thanks, Dr. Nada, for correction. I thought about the thyroid, not the parathyroid. So the cause here is clear, related to the iatrogenic parathyroidectomy, post-thyroidectomy. This is our case today. Any question, any comment? Dr. Mahmoud will join back.
Okay, hello, doctor.
Yes, I can hear you now. Yes, yes.
I can put hypoparathyroidism, iatrogenic hyperuricemia in my differential diagnosis.
Iatrogenic hypoparathyroidism.
Yes.
Yeah, this
I
is the
need to ask
case.
you what is your differential diagnosis? Because I know this is case, I catch the case. This is case of hypocalcemia due to post-surgery.
Yeah,
But
yeah.
in my differential, I will put it. Then I will mention, as the doctor mentioned, this is the Raynaud and cervical, like this.
So
He
this
is
is not the differential. This is the cause of the case. Iatrogenic parathyroidectomy, post-thyroidectomy.
Yes, but
Yeah,
Dr. Al-Taiba, she mentioned hypocalcemia as first differential diagnosis. I
yeah,
mean,
yeah,
I will,
yeah,
this is okay. Okay.
yeah, yeah.
Because a
We
lot
should
of,
mention.
okay.
We should mention it clearly. All the case, the
Uh,
diagnosis: hypocalcemia due to
okay.
parathyroidectomy,
Yeah.
iatrogenic parathyroidectomy, post-thyroidectomy surgery. Yes.
Okay. Yeah. This is full diagnosis, full differential diagnosis.
Yeah, yeah.
Okay. Okay.
Cause it's differential. Yes. Okay. Thanks, Dr. Mahmoud. Thank you, Dr. Awatif.
Yes,
Any other question?
sorry, Dr. Basim. Yes, I
Uh-huh.
have a question. Also, in this examination, we need to check also for hypo and hyperthyroid state in examination. My question in benign familial hypocalciuric hypercalcemia, in which hypercalcemia, no hypocalcemia.
Again, what the question? How to ask about it? By renal stone.
Benign familial hypocalciuric hypercalcemia, in which there is hypercalcemia, no hypocalcemia.
How you can check for hypercalcemia and the patient having hypocalcemia?
No, different, because Dr. Awatif said that need to ask about this syndrome in family history.
Yeah, the syndrome is called
hypercalcemia.
hypocalcemia
لا
hypercalciuria.
لا يا دكتور هايبركالسيميا هايبوكالسيوري syndrome is
Hypocalciuric hypercalcemia.
hypercalcemia.
Yes.
I think
This is the question,
yeah,
huh?
there is both. There is both.
Yeah, there is hypocalcemia hypercalciuria. Yes, with the
both.
renal stone, recurrent renal stone.
Yes,
Wait,
and
I'm
there is
checking it.
hypercalcemia, hypocalciuria. Yes.
Okay, I'm checking anyway. Hypocalciuria, hypercalcemia. Okay, there is. Yes, you're right. And there is also hypocalcemic hypercalciuria. There is both, familial both. Okay, I'm
Okay.
just copy. Yes,
There is
I'm copying
both.
it, and I will. Yeah, there is both. Yes, there is.
Yes,
Yes.
there is both.
So I share it now. Familial hypocalciuric hypercalcemia. This is what's mentioned by Dr. Shema,
Famous.
right? Yeah, it's
Yes,
rare autosomal.
yes,
Rare
it is the
mutation.
famous one. It
Yeah,
is
this
the
bad.
famous
Okay.
one. Okay. And there is hypercalciuria, hypocalcemia. Also familial.
Yes, there is also another one. Yes, I found high calcium in the urine. Yes, I remember from part one and part two. There is because this one will have recurrent stone, recurrent calcium stone. This is the second type. Some people with autosomal dominant hypocalcemia have high level of calcium in their urine, hypercalciuria, which can lead to deposit of calcium in the kidneys, nephrocalcinosis, or the formation of kidney stones, nephrolithes. This condition can damage the kidney and impair their function. So there is both Dr. Shaima and Dr. Mahmoud. Okay, is that clear? So I will put here the hypocalcemia one, not hypercalcemia one, because the hypercalcemia, it's
Okay, doctor.
hypercalcemia. Sorry. Yes, Dr. Shaima.
It is
Actually,
rare.
I
It is
am
rare.
It is rare,
I am
but
Dr.
yeah,
Hassanin,
but
Dr.
it's
Basim.
there.
How are you?
Not present. Yes, yes. I search.
Yeah, please. Yes, Dr. Hassanin. Can you be closer to the mic? We can't hear you well.
I said there's both. Are you hearing me? Are you hearing me, Dr. Basim?
No, still far away.
A second.
Okay, Dr. Nusaiba, can you write your case for Dr. Awatif?
Yes, Dr. Basim, there is both.
Yes, clear now.
Thank
Okay.
you.
Still,
Thank you. Thank you.
yes, Dr. Hassanin, you can say.
Yes, there is both. There is familial hypercalcemia, hypocalciuria.
Okay,
And
yeah.
there, yes. And there is a hypocalciuria, hypercalcemia, familial. Thank you.
Thank
But
you too.
but the famous one, it is about talk about the Kasar gene, which is actually asymptomatic. I think this entity, familial hypocalciuric hypercalcemia (FHH), it is asymptomatic in patient. So in the American guideline, they used to send 24 hours urine calcium for everyone who has hypercalcemia, even if there is no family history, because if you have your father or your mother have this entity or this condition, they would have no will have not symptoms. It is asymptomatic condition. Thank you.
Yeah, okay. Thank you, Dr. Hassanin. Dr. Nusaiba, did you write your case? Any question, any comment? Don't forget to mention the ECG
I am
in
writing,
this
Dr.
patient.
Basim.
Okay, thank you.
I am
The
writing.
ECG, waiting for you. The ECG is very important in this patient, and the long QT. Since this patient, once this patient is having long QT, it's important to admit the patient and to give him calcium gluconate. It might be IV infusion over the day. And yeah, you will monitor the ECG during this time. It's very important to mention 12 lead ECG in this patient. Okay, and for the long term, you will replace the calcium, and the bone profile is very important, as mentioned. Multi-theory team approach, and follow up with the GS and thyroid endocrine team for the thyroid state. Dr. Shaima, did you find the case?
Yeah, I find the case.
Okay, any point to be added by anyone?
Sarah.
Okay, 26 years, female,
Yeah,
abdominal
Miss
pain.
Sarah, 26 years old, complain of abdominal pain.
Yeah, my dear, we can change the name because we have one doctor named Sarah. Yeah, let's name the patient Lisa, okay? So I will delete Sarah, okay? We'll name the patient Lisa. Sorry, Dr. Rabi, I used to change any name while our doctors, including this name. We have in the list Dr. Sarah.
Miss
Yeah.
Sarah.
No, we changed to
Miss Sarah.
Lisa,
26
Lisa.
years.
Dr.
Lisa.
Nusaiba, please, change it to Lisa because we have our colleague in the group attending Dr. Sarah, so I don't want to do that. Okay.
I share in the chat box.
So Miss
26.
Lisa, yeah, Miss Lisa, 26 with abdominal pain. 2 minutes, then we'll start.
Yeah.
Are you ready, Dr. Nusaiba?
Yeah, I'm ready.
Okay, I will start. Hello.
Hello.
Hello. I am Dr. Ahmed.
Hello.
Yes, I am Dr. Ahmed, senior house visitor in this clinic today. Can I confirm your name and age, please?
I am Miss Lisa, 26 years old.
Nice to meet you, Miss Lisa. We are here to discuss some issues related to your medical condition. Is it okay with you?
Yeah, okay, doctor.
It came to my mind that you have tummy pain. Can you tell me more about this?
Yeah, doctor. Actually, have this tummy pain for last. I don't know what's going with me. All my body feel pain. I try several medication, but no benefit.
I'm really sorry for this. When this started exactly, this tummy pain?
Yeah, this is coming and back for a long time. I cannot remember exactly.
When was the first time you have this tummy pain?
Dear doctor, for a long time. Since I am in the school, I have this pain, but now have become more frequent.
Do you seek medical advice regarding this before?
Yeah, I see
Mhm.
medical advice in every hospital, but everyone tell me something different.
They got me you any medication?
Yes, I take some for this acid and painkiller, but actually it does really come to me every time and then as there is relief for a little bit, but after that come every time comes this pain, every time and then comes this pain.
You said that it became more frequent. How many times during the month?
Yeah, become more frequent.
Mhm. How many times during the month?
Maybe 3, 4 times.
There is anything increase this pain, like increasing after taking of food
No, not related, doctor.
or certain time of
I
food?
try to deprive myself from everything, but still I have pain.
Mhm. Is it improving when is it improving when you are bending forward, for example?
No, no, doctor.
Is it decreasing by fasting
No, no, doctor.
or any type of medication?
Maybe a little bit with this painkiller, Adol, Brufen.
Yes. Okay. This can I know what you mean exactly by this tummy pain? Is it pain in your tummy or is it food indigestion?
Oh, Ben, doctor.
Mhm. What is the site of the pain exactly in your tummy?
Actually, over all my body, I can. Every doctor tell me that, but I cannot. Over all my body, maybe intense in here and here, but over all my body.
All your body, not tummy,
Belly,
belly. Yes.
tummy.
Okay. What is the duration of the pain during the one attack?
Maybe lasting for 9 hours, 10 hours, maybe up to 1 day.
Mhm. Is this pain going anywhere, like back or any other part of your body?
No, no, doctor. But I feel sometimes my knees, my ankles have some pain.
Mhm. Mhm. Knee and ankle also. Do you have any pain in your chest also before? Any history of chest pain?
Sometimes, but not that much.
You seek medical advice regarding this?
Yes, I see medical advice several times.
Mhm, mhm. Okay. Do you have any family history of similar problem?
Actually, my my younger sister, but not like me.
Mhm, mhm. Any diagnosis for her?
No, still, doctor.
Besides that, you have any high temperature?
No, no, doctor.
Okay. Besides this tummy pain, you have any loose motion?
No, no, doctor.
Or hard,
Maybe at the
or
time
hard
when the
motion?
pain only.
Any hard motion?
No. معلش دكتور باسم، بس جاتني حالة في الطوارئ، يمديني أوقف التايمر وأمشي وأجي أشوفها بس أحط لها الإمرجنسي ميديكيشن وأجي.
Okay, okay.
أوكي.
Sorry, Dr. Atif. We will wait and I will pause the record, okay?
Okay, تمام. Okay, Miss Lisa,
Yeah.
you have joint pain. Can you
Yes.
tell me? Yes. Since when you have this joint pain?
Actually, the same time, coming and go.
Mm-hmm. Mm-hmm. Yes. This joint pain is it increasing with movement or rest?
Actually, increasing with the when the rest is feel better. When
Mm-hmm.
start walking, I feel more pain.
Is it associated with any fitness? Any stiffness?
No, no, doctor.
Okay. I want to ask you if you are beside this tummy pain, you have any throwing up?
No, but feel to be nauseated. I feel very sick, but actually not throw up.
Any hard emotion?
No, no, doctor.
Any difficulty swallowing?
No, doctor. No.
Any soreness in your mouth?
No, no, doctor.
Any yellow discoloration of your eyes?
No, doctor. No.
Okay. Do you have any allergy to anything or any medication or any food or any other allergy?
No, no, doctor.
Any stresses
Nobody
in
told
your
me
life?
that.
Any stresses in your life?
What?
Any stresses in your life?
No, no, doctor. I feel normal life. I enjoy still married. I live with my father and mother.
Any history of high blood
Still, I'm
pressure?
doing university. All my things setting down.
Okay. Or your senses. Okay. Okay. Do you have any history of high blood pressure?
What?
Any history of high blood pressure?
No, no, doctor.
High blood sugar?
No, doctor.
High cholesterol?
No, doctor.
History of heart problem?
No,
Any family history of heart problem?
no,
Any history of sudden death in your family?
no, no, doctor.
Okay. Do you have any history of any surgical operation?
Yes, doctor. At one of the attacks, some hospital told me maybe something inside abdomen and open my belly the very early way. After that, there's nothing.
Any history of any gland disease?
What?
Any family history of a gland disease?
No, no, doctor.
Or you have any history of a gland disease
No, no, doctor.
or defense disease
What?
or defensive disease?
No, no, doctor.
What medication you are on?
Actually, in this medication for pain, only take paracetamol, take Buscopan and Brufen. And some doctor prescribed to me something called colchicine. I don't know. I feel it's better than others.
Good. Any recent medication you take recently? Any medication you take recently, like antibiotics for any infection, for example?
No, no, doctor.
Do you take alcohol?
No, no, doctor, not allowed. I am Muslim.
Yes. Okay. Good. Do you have what is your job, Miss Lisa?
Still, I am student in university.
Is this your condition affecting your study performance?
Yeah, so much, doctor. I have a lot of absent, lot of lectures, and there is more issues in my academic files.
I'm really sorry for this. We will try to figure out your condition and we'll treat your condition as appropriate so you can continue your life easily. Is it okay?
Okay.
Okay, good. I need to examine you.
Yeah.
Okay, I want to invite this for the patient. Any abnormality vitals?
Over what?
Any abnormality in the vitals of the patient?
What is your question?
Any abnormality in the vitals of the patient?
No, no, apart from tachycardia and little bit hypotensive. 110.5 over 9 over 80 and tachycardic.
Okay. Then I will go to the see if there is any pallor or jaundice.
No.
I will do expose the chest and abdomen to see if there is any signs of liver disease, and also I will check the abdomen. I will do.
For what?
Do you have any pain? If you have any pain or discomfort, let me know.
Yes, yes, doctor, I have pain. Now I have
So,
pain.
yes. So I need to examine your tummy. If you feel that you are discomfort, you can tell me. Is it okay?
Okay, okay, you can do it.
Any tenderness?
Yes.
Yeah. Yes. Then I will. Which joint that you said that you have pain? You said that
No,
in the
my knee joint, my knee joint.
both knees. Okay. I will see if there is any sign of inflammation. Then I will.
What?
Uh,
And then swallow.
yes. Yes. There is tenderness. There is any sign of
Yes,
inflammation.
yes, little bit hot.
Mhm, mhm. And then I will move to see if there is any crepitation or any pain.
No, no.
Then I will auscultate the chest for any crepitation, and also I will do I will auscultate for any pericardial rub. And
No.
yes,
No,
that's
no,
all.
no.
Yes. What is your concern, Miss Lisa?
Actually, doctor, what half is going? I suffer a lot. What my problems? I want to know what my problems can be treated.
I highly appreciate your concern, Miss Lisa. Yes, from what you said, Mr. Exam, you most likely your condition is called familiar Mediterranean fever. The condition in which there is affection of the cover layer of your tummy, and sometimes like your condition in the joint also, and in other people also can affect the heart, the covering layer of the heart and lung also, causing pain like you have. So what we need to do for you, we'll do for you further blood test. We will do for you imaging your tummy to exclude any serious conditions. And after confirming this, we will put you under a follow-up with the joint doctor and specialized nurse. Um, yes, that's all. Actually, this condition is treatable, fortunately. We'll give you, after confirming the condition, we will give you treatment, and then it will be resolved. And we'll put you under follow-up for any complication that can happen anytime.
Okay, doctor.
And this actually is long-standing disease. I'm really sorry to tell you this. But we'll put you under our
How can feel better? How can do my daily activity to go to my lectures? I don't know.
yes, after receiving a treatment which is
Anything can
similar.
do to improve my life?
Yes, after receiving the treatment, which is a painkiller, your condition, the pain will be resolved, and you can continue your life easily. Is it
Yeah,
okay?
yeah, doctor. Okay.
Thank you. Do you have another concern?
No, what about my university? Have lot of report against me.
Why? Why you have a report? Because of the
Because
absence or what?
absent of exam, absent of lectures.
Don't worry, Miss Lisa. We will contact the social worker. He can contact your university, and he can give you a solution for your condition.
Okay, time is up. Time is up. Let's go to the examiner time.
Present your case.
This patient is a young patient, female, came with abdominal pain, plus history of joint and chest pain, which are recurrent in nature, with seek medical advice many times, with vast medical illness of surgical operation, and she's yes, that's all. her condition is severe, that affects her life performance, her life activity. And on examination, she has tenderness in the on abdomen examination. She has tenderness in her abdomen. She has on joint examination and the knee examination. She has signs of inflammation, which is increased temperature of the joints. That's all. Yes.
Yeah. What is the differential?
My differential for the case it can be familial Mediterranean fever, in which this in view of this recurrent abdomen or recurrent sinusitis manner, and also can be a gastritis.
What else?
In view of
What
the
else?
yes, gastritis in view of the painkiller using, and also can be pancreatitis. But again, is that the description of the pain, not going with pancreatitis. Also can be because of the infection in her abdomen. Again, is that no bowel habit change. Hello.
Differential for recurrent chest pain, recurrent abdominal pain.
Yes, can be intermittent, also intermittent uh, abdomen intermittent porphyria.
Acute.
Hereditary angioedema.
Acute intermittent porphyria. Yes, and hereditary angioedema also. Yes.
Sickle cell anemia, Addison disease.
Yes.
All this can be reserved to the recurrent abdominal pain, familial Mediterranean fever, sickle cell anemia, acute intermittent porphyria, hereditary angioedema. How to be investigate this patient?
I will investigate this patient by doing basic investigation in form of complete blood count, function test, electrolyte, and inflammatory markers, especially inflammatory markers. A renal function test also for any complication. We will do for him also imaging or X-ray to the joints affected. Yes, that's all.
Do for sickling, we do electrophoresis for acute intermittent porphyria. Should be excluded the others.
We will exclude the others also here. Okay.
Okay. What's the treatment?
Treatment, I will consult the patient about this condition, and we put him under follow-up for any complication, and also I will give him a painkiller, which is quercetin. Yes, and if this
Okay.
yes, yes.
Okay. The chronic management or chronic painkiller for this patient.
But it will be quercetin also.
Quercetin also. Okay. That is all.
Any image in this
Dr.
patient?
Basil?
Yes.
What?
Any image to be done in this patient?
I will do image.
Yeah, should be done.
Yes, yes, I will do image for the abdomen. It will be X-ray because this acute abdomen, I think. And also, I will do image for the joints. Yes.
Yes. Okay. Okay. Thank you, Dr. Awatif. Well done.
Okay.
And thanks, Dr. Nusayba, for the case. Let's hear the comment from Dr. Nusayba, then I will. Okay.
Yeah. Dr. Awatif, in the first you are swimming in the abdominal pain. Try to be fast. If not get anything from the analysis, go for any past medical history should be unknown of joint pain. We can catch from the joint pain. you can catch from the history of the surgery, family history of similar condition. Okay. This pain have psoriasis, so forms the peritoneal, recurrent abdominal pain, has surgical operations, and joint pain, and sometimes chest pain with the family history of positive for similar condition. Okay.
Okay.
That is all. Our differential will be familial Mediterranean fevers, sickle cell anemia, especially joint pain, chest pain, and DKA can be present, and hereditary angioedema. Should be asking me about my water work, not asking me about my urinary. Any what this all was division. Okay.
Okay, تمام.
Okay. Management will be from the basic lab inflammatory marker, exclude the other differential behind because sickle cell should be excluded. Acute intermittent porphyria should be excluded. Hereditary angioedema should be excluded. And the acute management we have the acute pain should be have rehydrated and painkiller. The chronic medication and colchicine. السيرجري السكار انت ما عملتي كومنت على الاسكار ولا على الشكل يعني نور الاسكار في الاكزامينيشن حقك وفي البرزنتيشن حقك. اوكي
جميل. اوكي
دكتور عواطف انت جنور الاسكار في الاكزامينيشن في البرزنتيشن في الفايندنج حقك جنور الاسكار.
To do what in the examination presentation?
انت جنور الاسكار حقك في البرزنتيشن حقك.
Yes.
ضمن الاسكار ignore it.
Yes, you are right.
That is all.
Thank you.
Okay, thank you.
Thank you. Thanks all. Thanks Dr. Nusaiba for the case. Thank you, Dr. Awatif. Well performance. So let's start the comments. Starting by the complaint, the abdominal pain. The onset, course, duration, OCD. Onset, you ask, it was for long time. The course on and off. Duration is almost 4 hours and lasting long time. Then any previous history? Yes, it was. So positive previous or previous history of the same attack since childhood. Since childhood means something is chronic. And as mentioned by our colleague, the three positive or the three possible diagnoses for the chronic abdominal pain, it's for PACEs, characteristic question, acute intermittent porphyria, or familiar Mediterranean fever, or angioedema. This is for any chronic abdominal pain lasting or starting since childhood. Others can be, but it will not be the long duration. For example, chronic pancreatitis, it will not start from the childhood. Renal colic can be also there. DKA can be there. Yes, DKA you can put as one, as a chronic, especially in type 1 diabetes, DKA. So you can add this one to be the fourth cause. DKA, acute intermittent porphyria, angioedema, FMF, or familial Mediterranean fever. Okay, let's move to the what's improve the pain, what's the use or what's the improve or reduce, what's worse the pain. And the painkiller, again, Dr. Awatif didn't ask about the scale of the pain. From 0 is no pain and 10 is the maximum intensity, and more than 5 will offer painkiller. This is for the pain analysis. You can add for any pain radiation, and you will ask like where this pain goes, where this pain travel or goes, means where exactly and where the pain move or goes. For example, if renal colic, it will start from the flank and it goes or radiate to the groin. This is for the radiation. It's important to ask as well. And for the GI, because of we are having the abdominal pain, so we will analyze the GI system as full analysis, as Dr. Awatif did exactly. She starts by difficulty for swallowing from up, then feeling sick, throwing up, any change of the bowel habit, any yellow change or yellow coloration of the eyes, any mouth sores. This is very important. Any blood per your back passage. Sorry for this question. So when you have a complaint in the system, like the tummy pain, better to ask about all other relevant system related to the complaint. For example, abdominal pain, so you'll ask all the GI system, as Dr. Watif did. Then we can go system review one by one. But if you want to rule out any serious condition, ask for the constitutional symptoms. For example, Dr. Awatif asked here about temperature. Yeah, it's one of the constitutional symptoms and it's related to the condition. So from the name of the disease, familial Mediterranean fever. So one of the component is the fever. She asked about the fever, but we could ask about also the weight change, and appetite, lumps or bumps, any night sweats. So this question for the seriousness of the disease. It might be cancer, so the cancer will be presented with this constitutional symptoms. Let's move to the other system review, starting from up downward. So the CNS in the form of headache and some other symptoms like pins and needles, weakness, vision affection. Quick review, just 2 or 3 questions. Okay, rolled out the CNS or finish the CNS, go down to the endocrine, any weather preferences. So this is the most characteristic question for the endocrine. Then you can go to the cardiovascular system, chest pain, awareness of heartbeat, then the chest system or respiratory system, cough up of blood or short of breath, then downward GI already done by the relevant system. Then we will go to the genitourinary, which missed by Dr. Awatif. So it's important here to ask about the genitourinary. And the question will be any change of the water work, color, amount, frequency, or any blood coming with the water work, any stone, any gravels, any pain while being or while passing water work. In this patient, you might have some pain. So you should ask about this system. Then skin and muscle and joint. Skin rash, I think Dr. Atif also missed skin, any skin changes. The joint, she asked and she found there is knee or joint pain. And all of the joint pain will be polyarthropathy. I mean, not single joint, because this is a disease for joint, arthritis. Any joint can be affected. And she asked a question for the nature of the pain. It was positive while moving. This is a mechanical cause of knee or joint pain. Then the family history, very important in this patient. And we have positive family history, means the daughter, the sister, although the disease is autosomal recessive, but maybe the father is a carrier, and that's why the daughter, the sister was positive. And this patient also positive. Might be the mother was positive as well, but at least one member in the family to be positive. Okay, what if the father and mother were intact? Would you think about the disease? Yes, can be because it's autosomal recessive. Both of them are carrier, and now the disease will be manifested in the children. It's very important in this patient. Another clue in this case, if the patient or surrogate told you, I am adopted, means that there is a tricky point behind this. Adopted in cases means the patient has family history and they want to hide that. Okay, most of the patients, but it doesn't mean that it will be positive, but it's a clue. Okay, let's go to the travel. Abdominal pain with travel, you can think about traveler symptom as gastroenteritis, but it's not relevant here because it's a chronic course of the disease. Medical condition is very important. You can ask this question earlier when you suspect another condition. For example, in this chronic condition, you can ask about what medical condition you have, or you have any long-lasting disease I should be aware of. In this case, you might have positive surgical history. Why? Because of misdiagnosis. This patient having frequent abdominal pain. One time of this admission, the surgeon might have the positive rebound tenderness and they will suspect appendicitis and they will do appendicectomy, or they might think about cholecystitis and they will remove the gallbladder cholecystectomy. So the disease of membranes, serous or serositis, the same as for SLE, pleurisy and pericarditis and peritonitis, along with fever and joint pain. This is the familial Mediterranean fever. HIV, you can think about here if you have vague symptoms along with serious infection, but it's not necessary. But the system missed here, Dr. Awatif, also the female history about the period and the children and the intimacy. Okay, let's go to the examination. You started the examination of the vitals. It will be normal. Blood sugar, blood pressure, heart rate, all these things mostly normal. Then examination of the complaint, abdominal pain. It will be generalized tenderness, but you should offer everything because this is your case, abdominal case. Superficial palpation, deep palpation. Before that, inspection, of course. Inspection, you find the scar. You should pass your finger over the scar or cross the scar by your finger to show the examiner that you found a scar. Try to comment on the scar. I mean at the presentation because it might be also infected if recent any keloid, any pigmentation. It's very important. So analysis of the scar or discover the scar by inspection. I will go then to do the palpation, inspection, palpation, superficial palpation, then for any mass, superficial mass, then deep palpation for liver, for spleen, for the kidneys, and then percussion for the ascites, auscultation for aortic and renal berui. In certain cases, you should do all these steps. Okay. Apart from this examination, yes, I could do examination of the chest for pleurisy or for the heart to search about pericarditis, pericardial. It's important as well. I guess no other positive finding in this patient because the main complaint the joint pain. Yes, I should do joint examination. Any joint was complained by the patient, I should just do look, feel, move. Look, feel, move. I mean the knees. Look to the knee, any deformity, any swelling, any redness, this is by look. Feel feel over the joint by the dorsum of your hand. Is there any tenderness? Is there any hotness or signs of infection? And move. Still in the step of feel, you can feel the effusion if there is effusion, okay? Or crepitation. This is the fourth. So I will feel what I feel. I will feel the hotness by dorsum of the hand. I will feel the tenderness. I will feel the effusion. I will feel the crepitation or crepitus by moving the joints. Then move the next step for the joint. So look, feel, move. The last step is move. I will ask him to passive move the joint, and I will put my hand over the joint. If he could do the movement, so no affection, no deformity. I will also look at his face at the same time to check for any tenderness. The tenderness will appear on his face. Always look to the face. Always look to the face for the tenderness. Then active movement. So I ask him for passive movement. I will ask him for active movement. So I will move the finger, the knee by my hand, up and down. I will see if there any limitation, any crepitation, and any deformity. So our definition in this patient will be, as I mentioned earlier, the four common causes in cases for chronic abdominal pain: familial Mediterranean fever, hereditary angioedema, and DKA, and acute intermittent porphyria. You can add to them if the patient has renal colic, renal stone, or renal colic. You can add as well chronic pancreatitis if you suspect chronic pancreatitis. Sorry, I missed the alcohol and job and smoker, and she did it, Dr. Awatif. Actually, it was a great Dr. Awatif performance, and we can receive the comment. Yeah, let's talk
Hello?
about the investigation. Yes. Sorry,
Yes.
Dr. Hassan. Yeah, I will adjust the scientific part, then we'll receive the comment. So, starting from the investigation, basic workup. Before investigation, you can mention to the examiner, according to the scale of pain, I could admit this patient. If he's in severe pain, I can admit him. Or if no pain or less pain, I can arrange follow-up. Okay, let's go to the investigation. Baseline basic investigation, CBC. Inflammatory markers, very important in this patient, CRP and ASR, and it might be there. And renal function test, if I suspect amyloidosis, because this patient have chronic disease or chronic disease, so I might find amyloidosis and I might find renal affection. So I could offer for her the patient's urine dipstick and kidney function, urine analysis for proteinuria. Then liver function test and the image, ultrasound abdomen. The management, multidisciplinary team approach, and non-pharmacological management, patient education, counseling about the disease, the association and complication, and how to be well hydrated to prevent further attack, and the follow-up. In this patient, I could say about her social or occupational. I could add occupational team for her scientific leave or sick leave. Then the pharmacological, as mentioned by Dr. Nusayba and Dr. Awatif, for the chronic colchicine, and for the acute attack, I will give pain analgesia or painkiller, good analgesia, along with good hydration. And
For chronic
treatment of complication, amyloidosis. Yes, Dr. Awatif, I am done. Okay, what?
Yes, for maintenance also we will give patient colchicine.
Yeah, this is for the chronic.
Okay.
Yeah, for the acute, non-steroidal as a strong analgesia. Okay.
Okay.
Yes, Dr. Hassanin, any your questions?
Thank you, Dr. Basim. I would like to add this point regarding the differential diagnosis of episodic abdominal pain. which is a common cause and basis.
Yeah,
As
you're
the
right.
my colleague said, number one, FMF, familial Mediterranean fever. Number two, hereditary angioedema. Number three, acute intermittent porphyria. And if the patient's middle age or يعني old with the risk factor of atherosclerosis like DM,
Mesenteric
hypertension,
ischemia,
yes, we can edit the bowel angina, chronic,
Yeah.
not acute,
Yes.
chronic
Yes.
mesenteric ischemia. And
Yes.
there is entity, I think the MRCB like it is IgG4 related disease. Also, it is a condition with a sinusitis picture, like peritoneum inflammation, pericardial inflammation, synovial joint inflammation, maybe also a meningeal inflammation. So all these picture by joint pain, severe abdominal pain, pleuritic chest pain, feature of aseptic meningitis, and also by chronic pancreatitis. It is all within the condition called IgG4 and related disease, which is very important, I think, in the basis. يعني regarding the investigation of the FMF as the likely diagnosis, okay, apart from a baseline investigation, a metabolic panel and hematological panel, I would like to add metarabone provocation test and MEFV يعني genetic test, MEFV gene. I didn't remember it exactly, but I think it's called MEFV gene, a genetic study for FMF diagnosis. Thank you.
Okay, thank you, Dr. Hassanin. The comment, let's read the comment. I think even acute is colchicine. Yeah, what I'm sure about is in the chronic prevention is colchicine. For the acute, I could give non-steroidal and analgesia. I'm not sure about colchicine in the acute attack. Anyway, safety to avoid
acute,
triggering. Yeah.
I think the acute attack give a double dose of colchicine. The chronic dose of colchicine 0.6 milligram per day, and in the acute attack may reach the 1.6, 1.5, yes, or 1.6 colchicine.
Yeah.
Yes. Plus with non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, with gastroprotective like omeprazole. And if there is no response to these first line investigation in the long term, we will uptitrate to the anakinra canakinumab interleukin 1 antagonist. And I think in the patient safety, we can give him a bracelet, or maybe give him a book with a condition. If he has severe abdominal pain, so the doctors in the emergency medicine can read the diagnosis and avoid unnecessary operation. Thank you.
Thank you, Dr. Samir. Yeah, for complication is renal amyloidosis. Yes, that's why you should do kidney palatable or renal palatable in the examination. Biological agent, yes, you're right. There is what, as Dr. Hassanin mentioned, canakinumab.
Yes, canakinumab,
interferon alpha, yes. Yeah. Interferon alpha, TNF alpha blocker, canakinumab. The third
interleukin 1.
Interleukin 1, and yes, yes. So this is the 4 medication plus colchicine for the chronic prevention and non-steroidal in the acute state. Okay. Any other question or any comment? for this case. Any question for any point or any topic?
شكرا دكتور باسم.
Okay, thank you, Dr. Awatif. Well done, well done. Yeah, you were also organized during the history, and you did the target examination. I think you did great. This case, high yield in the exam, it might come by any diet and any center. It's common one. Yeah, thank you, Dr. Awatif. Thank you, Dr. Nusaiba. If no question, no comment, we can end the recording, and we'll grade you and wish you happy Eid, inshallah, and we will see you after Eid.
إن شاء الله.
If no question, we can, inshallah. كل عام وانتم بخير. عيدكم مبارك أجمعين. Yeah, كل عام وانتم بخير. Thank you all. I will end the record. Then I don't think even no nomination. So enjoy this off for 8 days, and I hope this Hajj will be safe and without any crisis. Then we will resume our session as soon as we can. See you soon, and good luck, good night. See you after Eid. Eid Mubarak أجمعين. كل عام وأنتم بخير.